Gallbladder 30 is in the posterior lateral aspect of the hip. It's at a junction from the anterior 1/3 and posterior 2/3 of a line taken from the prominence of the greater trochanter and the sacral hiatus.
Gallbladder 31 is located directly inferior to the prominence of the greater trochanter, 7 cm superior to the inferior border of the patella. To find the prominence of the greater trochanter, press the hips on either side to feel for a bony protuberance. To double check that you've found the greater trochanter, rock the leg from side to side and feel the bony protuberance moving underneath your hand. The distance between the greater trochanter and the inferior border of the patella is 19 cm. If you divide this distance into 3 equal units, each one of these units will be 6 1/3 of a cm. As the point we're after is 7 cm superior to the inferior border of the patella, it lays just a little above the superior border of the lower third. Gallbladder 34 is located in a depression which is anterior and inferior to the head of the fibula. To locate the head of the fibula, find the tibial tuberosity and move laterally until you find a prominent bony landmark. Be sure that you don't confuse the head of the fibula with the lateral condyle of the tibia, which is closer to the kneecap. Gallbladder 40 is located approximately at the junction of the line drawn along the anterior and inferior border of the lateral malleolus. It's important to articulate the foot and feel for a nice depression here. Mark your point in the deepest part of that hollow. Bladder 60 is located directly posterior to the prominence of the lateral malleolus. It lies in the deepest dip between the posterior border of the malleolus and the anterior border of the tendocalcaneus. Spleen 10 is located 2 cm superior to the superior border of the patella in a tender depression on the height of the muscle vastus medialis. We know the patella is 2 cm long, so we can use this to calculate how high up the leg this point should be. A common mistake is to mark this point too far anterior or medial. A good location tip is to have the person press their leg down into the bed, which will bring vastus medialis into relief, and you should be able to palpate the depression in the height of it that forms spleen 10. Stomach 40 is located 8 cm superior to the prominence of the lateral malleolus, 2 finger breadths lateral to the anterior crest of the tibia. To locate the anterior crest of the tibia, place your 2 fingers along the anterior part of the leg and feel for the bony ridge. Remember, when you measure 2 finger breadths lateral, they're not your own finger breadths. They're the size of your model's finger. These fingers are smaller than mine, so when I mark this point, I will make sure that the marks are closer to the anterior crest of the tibia than the width of my two fingers.